The following program contains mature subject matter not suitable for young viewers and images of an actual surgical procedure that may be graphic and disturbing. Viewer discretion is advised.
Everyone has to deal with health issues from time to time, even us. Yes, we're doctors, but sometimes we also have to be patients. Check out this.
Yeah.
It is great to see you, my friend. How are you,
buddy?
How have you been?
I have to get this prostate issue
Tell me more about
under
it.
control. So I'm getting up at night. I have the urgency issues. At times I have problems ejaculating.
So classic symptoms for BPH. I'd like to take a look at your bladder, take a look at your prostate. Something that's actually come around more recently that's very, very exciting is called the Resume procedure. We use steam energy to shrink the prostate. You have results very similar to surgery. So we'll take a look at your prostate, and then based on that, let's decide what you would prefer to do.
I like the way you think. We're here to fix the plumbing.
I'm getting a cystoscopy.
This is your urethra. Everything looks really nice and open. This is your sphincter. And you can see as I pull back, urethra starts to get collapsed on because of the prostatic overgrowth. So that's what's actually causing the obstruction.
You think a good candidate?
Sure. In Drew's case, he's been suffering from BPH, which means benign overgrowth of the prostate. So technologies such as Resume are really changing the field for men. This is the Resume device, and it gives off steam. When the cells are encountered with that high of a temperature, the prostatic enlargement starts to shrink over time. The first step is we're going to insert the scope into the urethra. You're going to see us basically deploy the needle. I'm going to press a lever. We're going to count to 9. 1, 2, 3, 4, 5, 6, 7, 8, 9. It's all done on that one load. So we're going to go now to the other side. We're going to do the exact same thing. So the entire treatment is now done for Drew, and most likely he will not need to be on lifelong medications. So I'm very happy for him. It's amazing. In 18 seconds, we're able to do what we typically would do with a standard operation.
Truly fascinating stuff. Of course, you all want to know, as do I, how is Dr. Ordon? He's a few weeks out from that procedure. We're joined also by urologist Dr. Michel. And Drewski, how's the prostate, my man?
Well, do you want me to stand up and show you how far I can pee now? I'm not quite up to your young buck status yet, but it's coming back. It's only been a month. And with that treatment, you're injecting the steam, causes quite a bit of swelling.
Right.
So I won't realize the full result until that all resolves. But I'm only getting up a couple times a night. The stream is getting better all the time. The other issues are all working real well. So that, you know, that's the big issue. And for men, you know, going into something like this, you want to, that's in your head. Are things going to work right? And that's one of the potential downsides with some of the older treatments.
It's an incredible procedure because now we can actually apply steam literally in 9 seconds to different targets within the prostate. And the prostate itself, within about 6 to 12 weeks, will start to shrink. And when it does, a lot of the symptoms associated with BPH start to resolve. And you're already beginning to notice some of the changes, but the maximal effects will occur within the next 4 to 6 weeks from now.
And what are the risks with this?
The risks are actually really nominal. If your physician is able to diagnose you as having all these symptoms be due to prostatic enlargement, then you've got to take a look at some of the choices. But for most men, they prefer not to take a lifelong medication. They prefer not to actually have a surgery, and they like to have an outpatient procedure where they can, again, maintain their sexual function. With this procedure, the opportunity to actually preserve the ejaculation is 95%. That means the likelihood of losing that is very, very slim. The procedure itself literally takes about 4 to 5 minutes to do. You get up and you go home. And literally within about 6 to 12 weeks, you start to get results very similar to surgery. The beauty of this is that you don't have to take medications for the rest of your life.
So is this a one and done?
It's a one and done, but remember that prostate and like any other tissue can continue to grow over time. But think about the worst case scenario. If you get regrowth in 5 years or 6 years, you go back for another 4-minute procedure. It's kind of like the LASIK for the prostate now. You go and have your procedure, go live your life, don't have to take pills, don't have to think about surgeries, and it works incredibly well.
Tell everyone what a TURP is and who might still benefit from that.
Absolutely. A TURP is when we actually go inside the prostate and we shave open the prostate, commonly known as a Roto-Rooter job. So the Roto-Rooter procedure is exceptionally good. It works very, very well. The downside to that is the loss of ejaculatory ability. So for most young men, such as Drew,
Thank you very much.
he wants to be able to preserve that. And by being able to do this, you're getting very similar results. You just have to be more patient. The benefit of the TURP is you notice the result the next day.
Right.
This one, you have to wait 6 to 12 weeks for it to kick in.
Well, and the message for men, you know, if you're having these symptoms, make sure you go see your doctor.
Absolutely.
Don't be afraid of what potentially you're going to lose. You have to address this problem. Make sure that it's not cancer.
Right.
And there are better options out there. And they cut the best parts of that tape out.
Absolutely.
If you can imagine.
Okay, here it is. We will have online the best parts of that tape. Dr. Michel, thanks for taking such good care of our man here. We'll be right back.